Hello, and welcome to this webinar on evaluating and sustaining your quality improvement efforts. My name is Liz Lamb. I'm the Quality Improvement Advisor from Impact BC, supporting the divisions of family practice. And I'm joined today by Sarah Fielden, who's the Evaluation Lead for Joint Clinical Committees in the Doctors of BC. Thank you to all of you who've joined us today. So there's no doubt that we're in a very complex and rapidly changing healthcare environment, and when we're doing quality improvement, we need a well-designed, reliable evaluation process so that we can really maximize the impact, as well as demonstrate that effectiveness of approach before we can spread it to other areas. Now, some of you might be thinking you don't need to know about evaluation and sustainment yet. Typically, we think about these things as we get to the end of a project, but I still remember hearing from one of the more established divisions that evaluation starts at the beginning. So the planning for this starts early, and I think it's important that we start talking about it early on. So the agenda for today, we're going to talk about the differences and similarities between quality improvement and evaluation, identifying those aspects of quality improvement that are going to support your evaluation process, and then some strategies to help sustain that improvement over time. So I'm going to hand over to Sarah Fielden now. Thanks for coming, Sarah.
Oh, thank you, Liz. Thanks very much for inviting me to be part of this webinar today. Hi, everyone on the phone. So I'm just going to go through a few slides to attempt to define evaluation in a bit of a brief overview. There is, of course, a lot more to cover once you get into specific types of evaluations or different purposes of evaluation, but I'm going to try and give you just a bit of an overview today of the different types of steps that you can be going through as you're planning and designing your evaluation, and some examples of potentially how you might organize your evaluation designs. I also wanted just to go back to what Liz said, and that importance of planning for your evaluation early, because what you often find is if you just come in at the end to do your evaluation, that you actually haven't collected meaningful data along the way, and there was no mechanism to kind of go backwards in time and collect that. And so if you're starting from the very beginning, you're making sure that everything's in place in order that if you're just doing a summative evaluation or at the end, or if you're doing a kind of a formative and summative evaluation, that everything's been collected along the way that you wanted to see, and you're not kind of backtracking at the very end of a program trying to show its worth or value. So defining evaluation and quality improvement. So Liz and I have just come up with some hopefully succinct definitions that we can kind of work through. So evaluation is a systematic investigation of effectiveness and or impacts. It's often evaluation is done at the program level, so you can say effectiveness and or impacts of a program. But you can also look at the organizational level, you can look at governance, you can look at principles. There's many different types of evaluations that you can do. Quality improvement is using a systematic approach to continually improve the experience and outcomes for patients and users. So there's different purposes of evaluation. I've just brought up a few that are kind of more common and more talked about, but depending on the purpose of your evaluation, your design might look very different for even a similar project. So there's this idea of fidelity, and that's kind of more of a traditional model of evaluation where you're looking at, say, a program model over time, and you're wanting to see if that model works as a whole, and you're wanting that model not to change. So whatever the elements of the program are at the beginning, you kind of want that to carry through to the end so you can say whether or not those elements in the program as a whole was successful. That type of design is often more linked to the idea of accountability and showing kind of, you know, if something is kind of passed or failed or is successful or not successful. Participatory evaluation, there's different levels of participation, and it depends on your target audience, who would participate. But an example of that would be you would engage your stakeholders from the beginning, and often the question or the evaluation issue would be coming from the community that you're working with. So that might be doctors, that might be patients, but you'd be working with that group, if you were an evaluator, to kind of help them design their own evaluation to address their own problem. So I'll just give you a bit of an example that I've done some work looking at children and families and doing a needs assessment with some children with chronic illness. And so when we did focus groups, I actually did a training, facilitation training with parents, and so parents would be co-facilitating the focus groups with me. And some of the parents and some of the children actually came and co-presented the results of the evaluation. So those are some ways that something can be more participatory as an evaluation. And then there's also this developmental evaluation purpose. So and this is a little bit harder to describe, but basically it's looking at this idea of strategies, potentially multiple strategies, and looking at what emerges from those strategies. Really looking at some of those strategies might be more successful, some of them might be less successful, and you're really trying to capture the development of those strategies along the way, often through kind of a reflective practice. The idea being that developmental evaluation helps you to really capture more complex systems, because often you're looking at innovation and new models, and you're wanting to look not necessarily at their success, but also whether or not they were, had challenges along the way. So some differences between evaluation and quality improvement. So evaluation shows that the whole program is of value or not. Whereas quality improvement aims to improve processes within a program, so it's more of a micro level. Evaluation may involve a decision regarding implementation, whether or not you actually carry a program forward and whether or not it has value over the long term. Quality improvement looks at beneficial changes are implemented immediately and continue to be tested, so it's more of a continuous process. Evaluation will often use larger data sets, whereas quality improvement might use smaller samples of data. Often evaluations, as we mentioned, it's on the program level, so quality improvement might use smaller samples at the practice level, whereas you wouldn't see an evaluation really usually framed at a practice level. Evaluation may use valid and reliable data collection tools, so like validated scales for questionnaire or survey. Whereas quality improvement will use data collection tools that allow simple and easy recording. So there are similarities between evaluation and quality improvement. Both rely on data. There is some type of study element to it. So both may use quantitative and or qualitative data as part of their assessment. And depending on the evaluation design, both may measure successes and failures, both may capture processes, and both may focus on learning and innovation. So as I mentioned, there's different purposes to evaluation, so the similarity between evaluation and quality improvement will depend on what purposes. So for instance, a developmental approach will probably have a lot more similarities with quality improvement than a fidelity or accountability approach, for instance. So why do we evaluate? We evaluate to measure a program's outcomes and impacts. Outcomes being, has it really met its goals, and impacts being more the longer term, potentially unintended impacts as well as intended outcomes. To inform future program planning and design, to provide important internal lessons for those conducting programs. So I'll talk a little bit about process evaluation, and that really is that provides those opportunities for internal lessons and documentation of changes and evolutions. We evaluate to provide broader lessons about good practice, and I would also say broader models of good practice as well, and to ensure transparency and accountability, again, depending on the goal of your evaluation. So the next slide is the project evaluation cycle. So we're going to be relying on this, both myself and Liz later on, to try and show how we can kind of marry quality improvement and evaluation through these different parts of the cycle. So I'll just start off, so kind of with the planning stage and early implementation, you have formative evaluation. So there's three kind of types I'll talk about. The first one is formative, and it focuses on programs that are under development. It is used in the planning stage of a program to ensure that the program is developed based on stakeholder needs, and that programs are using effective and appropriate materials and procedures. So it's really a type of evaluation that you would start from the very beginning. Process evaluation focuses on programs that are already underway. It examines the procedures and tasks involved in providing a program, and it seeks to answer the question, what services are actually being delivered and to whom? So really looking at, what types of, if it was an educational model, what types of workshops have been done, who's participated, how those worked along the way. Summative evaluation focuses on programs that are already underway or completed. It investigates the effects of the program, both intended and unintended, and it seeks to answer the question, did the program make a difference? So impact evaluation, and did the program meet its stated goals and objectives? So that's more of an outcome evaluation. So those three types of evaluation are kind of going on as part of the project cycle. And there's also the sustainability piece, which Liz and I will talk to a little bit later on. So I'm going to give you some examples of evaluation steps. There's lots of different models for this, or people will have more steps or fewer steps depending on whose model you're looking at. But this is the CBC evaluation framework model, which I like to use because it's health related. So there are 6 steps. The first is to engage key stakeholders, and the idea here is that you really look at who the relevant stakeholders that are in terms of your project or your strategy, and who the target audience is. So you'd look to engage a variety of stakeholders, and potentially some from the group of interest, for instance, the patients and physicians. We want to describe the program as a second step. So that's really when you would go about really looking at what the goals are, what the objectives are, creating a program theory or logic model, which I'll show you in the next few slides. Step 3 is focusing the evaluation design, and that's where you'd really look at what are your sources of data, like where are you going to get the information, who's collecting it, what types of indicators are linked to your various goals and outcomes. So that's where you really kind of get into some of those nitty-gritty details around your plan and how you're actually going to assess the program and its impacts. Number 4 is gather credible evidence, and that's where you'd actually be doing your data collection. So that might be qualitative, it might be quantitative, depending on how you focused your evaluation design. And the idea is you'd want to collect evidence that is credible in the eyes of your stakeholders and the people who are invested in your program. Justify conclusions. So this is a stage where you'd really be analyzing your results and synthesizing them for consumption. This is a stage where you potentially would be doing a lot of comparisons of your results, potentially against, say, a benchmark or other evidence. And then number 6 is sharing lessons learned. So this is really where you'd have your knowledge translation piece and really package up your results in a way where they can be understood by whatever target audiences you are trying to convey your results to. And it's also, there's kind of an iterative process here, so it's not necessarily the last step, but there would be kind of a feedback cycle where you'd be wanting to share your lessons along the way as well with stakeholders so they can kind of see how it's going. So we're looking at creating your logic model. And so this would be kind of at your step 2, step 3 stage. And this is really, a logic model isn't set in stone. It's often kind of changed throughout the course of a project. But the idea is that you're really looking at at focusing and looking at your logic along the way with what you think is going to lead to what and what that is going to lead to. I'm going to run you through, first it's going to be blank, and then we're going to fill it in with an example. So how you might create a logic model. This is a logic model that's really based on like a project. So you can have different levels of logic models. You can have logic models for initiatives, you can have logic models for organizations, and you can have logic models for programs and projects. So you've got your situation and your priorities that you're going to think about before you start. You're going to have your input, so what are you investing? You're going to have your activities and your outputs, so what are you doing as part of your strategy or your project, and what outputs are you expecting to see? And then you have your outcomes and your impact. So those are usually broken down in kind of shorter term, medium term, and longer term. So medium term, obviously there's usually a bit, they're further down the road, and longer term or even further down that road, looking at the impacts. And you've also got your assumptions and your external factors, which are sometimes included in a logic model, but not always. So just to kind of document how you're imagining these things all fit together. So I'm going to give you an example of a logic model that would address, say, patient attachment, and it's a patient attachment mechanism. So I'll just step by step go through what you might put in these different fields. So your situation is that you have a number of unattached patients in your community. Your priority is that you want to create a patient attachment mechanism in order to attach those unattached patients. So if we're looking at what we invest, so that might be funding, human resources, infrastructure, might be partnerships, and in a logic model, normally you'd actually list these out. So which funding? Who's your human resource? Do you have a coordinator or lead that would be kind of responsible for the project? And also infrastructure, you might be working in a hospital, you might be working in a clinic, so those are things that you would list there. What will we do? So this is an example from one of the divisions who kindly shared their project-level logic model with us. So we would obtain and implement a GP4Me hotline, a 1-800 telephone number, as one point of contact to find a primary care provider. The outputs that we would expect, outputs are usually things like volumes, so number of participants, number of workshops, in this case, number of calls to the hotline, number of referrals to primary care clinics, number of referrals to GPs. Your short-term results are usually things that you can measure over the short term. So in these, like more immediately. So you enable patients to find a GP, so kind of that count and who's been attached. Recognition that the hotline is the main point of contact for finding a primary care provider. So that's an issue of awareness, so an increase in awareness, and you might measure that through pre and post design of community or certain populations to find out if there actually is an increased recognition. And then medium-term results are potentially increased primary care access, better coordinated primary care, and your ultimate impact is that you want to increase the continuity of GP-patient relationships and also create an opportunity for those patients to attach themselves to a GP. So the external factors that you might be considering in that is obviously you want to be able to say that the outputs and the impacts that you're looking at are actually attributable to your project. So that's something that you want to consider. What other external factors might be influencing your outcomes? So for instance, if you were looking at ER, you're saying that your project is going to decrease ER utilization, and you're looking at volumes of patients in the ER over time. There might be other things aside from your initiative or your strategy that are influencing those volumes in the ER. So those are things that you need to think about when you're deciding what your outcomes are going to be and how you're going to attribute those outcomes to your project. Assumptions are things like you might be kind of making some assumptions around who the hotline, who can access the hotline. You might want to be keeping those assumptions in check if you're trying to reach marginalized populations, for instance. Not all of them will have access to a phone, potentially. So those are things you want to think about as you're designing your program. So who should carry out your program? So there's a few options here, and they're actually the options that I've seen, all of these options in GP4Me proposals. So you can have an external consultant, so someone who's not part of your team. They're often seen as more objective and more credible because of their objectivity. And they might have, they might be lending a different type of view or a perspective on your program that comes from being outside of all of the processes that are being put into place and all the assumptions that might exist in the design of that initial program. There are some disadvantages to external consultants, and they're likely more expensive, and it might take them quite a while to familiarize themselves with your context, and it might actually be more valuable to have someone who's got some familiarity, at least with your program. So external consultants, you might choose them. Joint team, I've seen this in a few proposals where there's kind of a health authority or more of an internal evaluator working with an external consultant. And these tend to be kind of less external or less expensive options because you have a bit of cost sharing there. And it might be easier to capture some specific types of data if you use a joint approach and have some internal staff working on it. Internal staff might not have the time or skills, though, and they might kind of have less objectivity. So there's some disadvantages and advantages to having a joint team. And an in-house expert, so an in-house evaluator, encourages maximum participation and involvement. They often already have relationships established, so they're able to draw on those relationships to move the evaluation forward. And it might be easier for them to collect data on an ongoing basis. The disadvantages might be that they need really strong skill set and good training and evaluation, and there may be a greater risk around, that person having their priorities diverted and changed because they're in-house staff. So there's a few different types of models that you can use in terms of your evaluators, but I guess the important message is that there should be someone on your project or team who is the evaluation expert or coordinator and can link kind of to the outside partners through that lens. So again, around who should carry it out, it really is looking at that balance between resources and skills that are required on a project and what you have internally and what exists externally. So thank you very much. I'm going to pass it over to Liz now.
Thank you so much, Sarah. That's great. Now, in preparing for this webinar, I've been asking myself, how can I demonstrate how QI, quality improvement, and evaluation work together? Because they are different, and yet there are some similarities. And this image of binoculars kept coming to me. And if I'll just describe this, if one lens is QI and the other lens is evaluation, both have a slightly different vantage point. But when we bring those two lenses together and they overlay, we can see that bigger picture more clearly and with more depth. So certainly as I started looking into what evaluation was, I started to see, and especially speaking to Sarah, we started to see these two pieces really can't do without each other. We can't have QI without evaluation, and, well, what would we evaluate if we weren't doing QI? So just keep that image in your head as we go through this. So in the first webinar, we talked about the IHI model. I'll just do a really quick recap. These first questions, 3 questions, are really at the heart of evaluation. It's what we seek to understand. So what are we trying to accomplish, and how do we know this change is an improvement? And what changes can we make that are going to result in improvement? And then the PDSA cycles, the Plan, Do, Study, Act cycles, they're really how we learn and what works. It's how we test them out. Now, for those of you who were at that first webinar, I also introduced 7 steps to QI, and I'm going to refer to these steps a little bit later just to try and illustrate again where QI and evaluation overlay. So, bear with me on this one. We introduced this model. We have the planning stage to start with. And for evaluation, we describe we engage the stakeholders. So this is the first step for evaluation. What are you really trying to figure out that they want to know from this improvement. And this is going to help inform that QI perspective, because really early on we want to figure out too, what's the aim of the improvement and what are we trying to achieve here? And it's that first part of the QI model. It's defining the aim. So doing this well is really going to help everyone understand what's the purpose and the goal of this initiative. What do you expect to happen? And remember, we wanted the aim statement to be SMART. We wanted it to be specific, measurable, achievable, realistic, and time-bound. So it's going to really help us focus early on. Next, for evaluation, Sarah described the program, developed the logic model, and it asks us to think about the expected effects, activities, and outputs that we expect. And it's the plan, it's the framework that the evaluation will follow. And for QI, we ask next, how will we know a change is an improvement, which really means how will we measure that difference? And it makes us figure out a measurement plan. What are we going to use? Is it qualitative or quantitative data? And it makes us think about the plan for who's going to collect it and how and when. So both the QI and evaluation certainly require data, and having this identified will really help. You don't want to get to the end and realize that you, as Sarah said earlier, you should have collected something, or that what you did collect wasn't of any use. And it's part of this next step, focus the evaluation design, which needs to know what data is going to be collected and how this is going to inform us as to whether the project or the program is an improvement. It also talks about practical methods for sampling, data collection, data analysis, interpretation, and we can talk about these together with QI. If we can do that, we're really one step ahead. The next part of the QI process, we always map the current state. It's really important not only to understand what's happening now, but to figure out what the current problems and issues are and why they might be happening. It's an opportunity to collect any baseline data, and by that I mean the standard by which you'll measure any improvements. And it's always surprising to me how little of this actually exists. I think we all have an idea of what's happening, but we rarely have any substantial evidence of it. So in quality, it's an opportunity, to talk to staff, to patients, as Sarah mentioned, and get a really good picture of the context you're dealing with. So in quality improvement, we're looking for that snapshot of information. We often use small samples. Observations are very common, and we don't actually need those vast amounts of information. It's an important step in QI, and if we can gather this, it can actually provide that pre-program marker. So I've put here one of those steps, gather baseline data. So when we look back, the evaluators can see what we're comparing that final outcome to. The next part of the QI model asks what change we can make that will result in an improvement. So this is about what ideas for change we have. And typically in QI, we look to research and we look to best practice to find those little gems to try out. So although the evaluation isn't going to suggest ideas, part of the evaluation process might want to ask, why did you think that was going to work and what's the evidence? So again, for both of these pieces, it's really worth communicating those ideas, sharing it and discussing what you think is going to work and why. So all these pieces fall into the planning stage of both evaluation and QI, which isn't an accident. There really is a lot to do in this stage. Once we start the implementation phase, actually testing our ideas out through these PDSA cycles, we start to accelerate our learning, and it's a great opportunity to then gather this process data, as we see on that little slide, for the evaluation process. So we're now collecting, we've got our baseline data and we're collecting our process data to really evaluate whether those changes introduced during that due part have been improvements in practice. So we should make sure we collect and document these cycles, because every cycle will produce something new to examine. This type of evaluation does help us find out how the project's going, and it can help us address issues as they come along. Remember Sarah talked earlier about fidelity-oriented evaluations, such as drug trials, where you're trying to control all the variables to see the efficacy of a drug, let's say. Well, PDSAs might not exist in that more traditional evaluation, so that is a big difference with some of those models. And that's why when we're doing continuous quality improvement, we need an evaluation approach that lets us test as we go. So we have to be able to adapt to the circumstances, change or alter that plan and make sure we're really moving closer to the goal. And then it's only after the testing is complete that there will be this additional summative data to collect. So, for example, that might include the focus groups or surveys to help us understand how that implementation phase went, what the impact was on the patients or the system you were testing. And then we go into this post-project phase where the evaluation draws together and analyzes all that data to get conclusions from what that information was. And that's to justify those conclusions, make recommendations and judgments on the program, whether they are positive or negative. And in that report, recommendations may be made regarding implementation. So it should clarify whether to implement the program or not. And this is really different in QI. We typically implement the improved change as soon as we can. So we might not actually see any of this post-project section as a period of time. Once we're satisfied we've made some improvements, we usually carry on and we continue that monitoring and tweaking just to make sure we can sustain the improvement that we saw or make it even better. So once that final report has been generated around this time, at the end of that project, post-project phase, this is where evaluation will feed back and disseminate that information. And this last point to ensure use and lessons learned. And that's really about transferring these conclusions into appropriate actions or decisions. So, as I said, in QI, once a change has been decided, we just make it standard practice. We want to move out of our test ground and we start wanting to apply it to that wider implementation. And so our last step for QI, well, it's easy to say that we celebrate success and carry on. This is where the next challenge really comes along, and that is sustaining the gains. Just in summary here, QI and evaluation both need to have discussions with key stakeholders. They need to be discussed together from the start. They both need to be very clear about what needs to be achieved. They both need to identify and collect data that's going to support both of them, and documentation of your QI and evaluation findings. They both need to measure and track data. So lastly, we're going to talk about this sustainment piece. There's really two aspects I'm talking about here. One is keeping the improvements going on a week-by-week basis. Let's say you made some efficiencies in your doctor's office. You might want to just keep those going. You want to keep on reducing cancelled appointments or whatever you were trying to do. And the other piece really is sustaining through spread. So you found something that was working in your area, let's say a GP retention strategy, and you want to share that with some other divisions to help them learn from each other. Evaluation can play a huge part in helping other divisions learn from each other. Even if something didn't work, it'll help that division learn from the experience. So how do we do currently with sustainment? Well, unfortunately, a third of quality improvement initiatives actually revert to baseline after a year. This was done in the NHS. They looked at 8 years of quality improvement audits. And then another third, they could sustain their gains, but they weren't able to spread those improvements. And then lastly, the third that we really want to focus on, a third did sustain their improvements and they spread them to other areas, and this is really key. This is how we want to get that improvement work across the divisions. Now, we've gone through our improvement cycle. We've had some ideas. We might have tested them out, making some progress. So, we're done, right? We made it. No. Actually, in my experience, this is the hardest part, sustainment. There's nothing more disheartening than seeing all that hard work slowly disintegrate once the excitement of that new change subsides, and it really can go back to business as usual. And if I think of some of the initiatives I've been involved with, there really are some common themes that I want to talk about next. So the first one is keep the focus. Let's say we want to improve access to primary care, and we have, let's just say we only have 3 initiatives. GP recruitment and retention, improve office efficiencies, or to develop a model of care. Each one has to have its own focus, and we have to see that it aligns up to our bigger goal of improving access to primary care. So really keep the focus. The other one is we have to report progress. Improvement only takes place over time. We don't suddenly see or feel improvements happening overnight. So in order to see if it has happened, it requires you to observe those patterns over time. And very simply put, this is a run chart. It's a graph that displays data over time, and it's one of the single most important tools you can use. So they help to identify problems. If we can see there's a little dip in January after a year, we can see when a problem might have occurred, and then we can start to see what we need to do to get it back on track. So I would suggest you start building this graph as soon as you have your aim statement. So, for example, this one would have been, we aim to attach 11,000 new patients by January 2016. And so we have our variable on the y-axis, that would be the number of patients. And the x-axis, we plot that data over time at regular intervals. And we always have our target up there, so we're trying to get to 11,000. The main point I want to make is keep reporting that progress over time. The other one is document your efforts. You have to document what's been done. It's not only a reminder of the work that was done, but it's really important when it comes to that process evaluation stage. And we're not talking about a report here. It's just a 1 or 2 page summary of what happened. And remember, this is where we're testing out our ideas and we're learning from them. An evaluation will help capture those. What worked, what didn't work. Involve the team. You really can't do it all yourself, and nor should you. We talked about creating a culture of QI in our last webinar, and for me, this is the most important part, that every single person in the organization sees improvement as part of their work every day. So if everyone's involved from the start and we can get that buy-in, it's going to help keep it going and help us figure out as a team why things aren't working the way we expected them to. And let's face it, the person doing the job probably has the best idea of how it can be improved. So it's a question of making them feel empowered and be able to contribute. If that improvement momentum's lost when one person leaves, or if we rely on the QI lead or some person to do it all, we're going to need to work harder to build that team. It's really about everybody's job to improve. And we also want to share with everyone how well we're doing and what we need to do to get back on course. And I've seen other areas do this through a stand-up meeting, a regular team meeting, just to go over process. Using that run chart is really helpful, and also to look at that PDSA documentation, that one-pager. Or better still, have the whole team collect some of that data and put that dot on the graph for you. It's then a chance to get that problem solving and come up with ideas, and helps really create that sense of ownership. Just to summarize, we've talked about the similarities and differences between QI and evaluation, as well as those steps in both processes that are going to support and complement each other as you go through your initiatives. And the 4 aspects of sustainment that I think have been the most valuable in my experience have been: keep the focus on what's happening, regularly report your progress, document your efforts, and you'll be friends with your evaluator for life, and involve the whole team in quality improvement. So I'd just like to thank everybody for coming. Okay, bye.